and welcome to this webinar. I'm terribly sorry for the inconvenience that this webinar was supposed to be broadcasted on Friday, but now it's Monday. So we hope that you will have survived anyway. And as you can see, we have organized ourselves, me and Lars, again in our Center of AI Innovation of Sweden. And last time around, we are trying to be prepared with a ruler here to be safe. So we have social distancing. As you can see here, Lars is sitting exactly 2 meters behind me, so we can be assured that we're not transmitting any viruses here, since we're going to talk about COVID-19. As you also see here, there's a difference between Anand and me being just a regular clerk. Lars has just attended the invitation and suits. I'm more casual clothing. So with that said, I will jump into next slide. Since this is a webinar, it is in broadcast mode, so all participants will be muted. So if you have any questions during the webinar, please put them into the Q&A panel in your GoToWebinar panel. And obviously, this broadcast will also be recorded. There will be a possibility for you to replay this, and it will be sent out to all the registrants following this broadcast, so you can binge this Nordic Health Data for next week. I'm glad to say that I have a great panel. So obviously Lars will be hosting this from the region of Västra Götaland and Swelife, and also AI Innovation of Sweden. It's going to be me, Fredrik Landqvist, who will speak a little bit about knowledge graphs and data catalogs and metadata. There will be lots of words about metadata. Then I will be happy to hand over to my fellow friend sitting in Sundsvall, Mattias Hem, who is information architect at the Agency of Digital Government, or in short, DIG. And the final presenter will be Magnus, who is also an information architect at the Swedish Research Council, and he is even further up here in the region, up in Luleå. So with that in mind, we are only Swedes today. It doesn't mean that this Nordic event should be only for Sweden. Also, anybody else could be able to participate. So I'll hand over to Lars.
Good to be in this webinar, and today we are going to focus a little bit more on how we actually can do things and other sources that are available for us. Complete the web for meaningful prediction and protection is very high. Never before so much data, never before so difficult to understand what it talks, and never before so hard what it said, and never before. And I hope this event we're doing today will clarify some of the things that it might be a light in the tunnel of understanding how we can get meaningful use of data if we just have some kind of structure, at least in our catalog services and metadata. So with that, I hope that you will have a good afternoon today.
So thank you for those wise words, Lars, and I will jump into my part of the presentation. I will do a quick recap of last event, since we were talking about fair data and fair data principles, which I think are kind of the foundations of how we get proper smart data management to be working in these days of the abundance of data. We have lots of data, but we don't have the ability to find it. So the first thing is obviously to be able to find your data, and then you need to make it accessible, leaning upon open standards and protocols to see to that the right person get the right information. Then Thirdly, we need to think about interoperability, and specifically semantic interoperability, so we can be able to decipher what is this data, does it speak about, what's the meaning of this data, so that we are able to link up this data and in the final setting be able to make it reusable in all different settings. That said, this is the kind of Bible for me. When it comes down to health data, most of you participants here are working within health data domain. We have lots of different standards that are available. We have medical subject headings, UMLS, SNOMED CD, ICD-10, 11. We have also different, data exchange standardizations like HL7, FHIR, and more. And these are the, around these principles of, defining what pieces the data speaks about in terms of health data, they are core to make things work smoothly. But we also have to be aware of that vocabularies are really big. Some of them have hundreds of thousands of words. You need to decide which standard should I rely on. You also need to decide which are the reference sets you need to run to picking and combine different standards and vocabularies in a set that works for a specific use case or for a specific organizing system, be it an electronic health record system or be it information, reaching for the target being, for example, citizens or patients here in these, stressful times with the coronavirus. There are main couple of topics I will speak about today. Knowledge graph. A knowledge graph supports principles because it's leaning upon those interoperable standards to how to describe whatever different data set you're speaking about. Knowledge graphs is nothing new. I mean, it's been around since Socrates started to make different models, mental models or symbolic representation of the world. And for us who have been working in IT or in this is what we have been for ages. I've been working with informatics and database modeling, entity diagrams, UML diagrams, different ways to capture the domain that we were speaking about. In this comes the knowledge graph very handy because that is an imaged representation of a specific domain where the different entities and concepts are related to each other, as you would have in a diagram, and where you will be able to describe and things both in domains that are human readable, as in this case. It could also be in machine readable format. And I think these are the key principles to make your data meaningful. You need to be able to connect your data sets, your information by being expressive in your metadata description. And in this case, I've used the W3C standard, which is the RDF, which stands for Resource Description Framework. There are other means to describe a knowledge graph. And to make it a little bit more comprehensible, I just took the opportunity to use Google. Everybody's been using Google, and Google has since many years now a so-called knowledge pane that you get on your right-hand side in your search results page when you search for something. And if entities, the things you speak about or the things you search for, what in your question, they will be presented by using the knowledge graph that Google has. And the knowledge graph that Google is using, they're using open standards and open data sets and open vocabularies like Wikidata, which has, I think as we speak, 75 million active. In that sense, SNOMED City with just 350,000 concepts, it's very small set of entities, but they are connected. Further, it's, everybody's been working with different controlled vocabularies, reference data that you describe the data points that you have. And one do is obviously taxonomy with broader and narrower concepts, but also you would be happy if you could express that taxonomy into a thesaurus where you have a richer term description with synonyms, acronyms, and the likes. When you need to build a ontology, which is the third word here that is kind of the underlying technology for a knowledge graph, is that you connect things with different relationships, not only relationships as broader and narrow terms as you do in a taxonomy, but also other, as in this example where we have a disorder condition has symptom or similar instances. And we've all been seeing quite a lot of different graph representations. So there's a lot of opportunities to, when you have a large data set with many data points, you're able to take those instances knowledge graph as the model and then visualize them and be able to traverse these rich, really rich knowledge graphs. And with further ado, I think I just skip the PowerPoint for 1 sec and just basically jump in a live demo. And this is always fun when you run a live demo. So this is an example of a knowledge engineering tool where you are able to either connect with open existing vocabularies as the ones mentioned in the beginning with MESH, UMLS, SNOMED City, but you're also able to build a rich vocabulary where you have broader and narrower terms, and you can also have increase with further enrichment. And as you can see here, with this one also, this condition indicates we are speaking about an ontology. And my wife sends me a love message, so that's happy for a Monday afternoon. So going back to the presentation here. So, and I'm hoping that I'm not going too quick in terms of the knowledge graph, but these are the the basic concepts about the knowledge graph. The second thing I would like to speak about is what we call a data catalog. And this is, everybody who is old as me and Lars, we have been to the library when we did our studies, and we used to use these, metadata cards to be able to locate whatever readable format of research papers or books we would like to have. This is the metadata cards that would be instantiated in a data catalog. So my fellow friend from DIG will speak a little bit about data catalog and metadata, and also Matthias and also Magnus. But I would like to think about a little bit more what you can do with a data catalog, because what you want to do is have a good data card, the metadata card, the specification that speaks about the data point you're reaching for, but also being able to connect those data points by using the knowledge graph or an ontology, if you will, so that you're able to decipher. So if you have multiple catalog systems, which you usually have, most large entities and organizations have a very heterogeneous set of data. So I took this opportunity to just look at specifically, well, our good old friend Google. Again, it's not that I'm sponsored by Google, but Google has, since a couple of years back, worked quite hard to be able to index and aggregate information about information that has been represented in different data sets, structure, tabular data that we are using. For instance, in this case, I was searching obviously for the coronavirus, and what they're doing is that they're indexing the internet, but anything that has been expressed with a resource description saying, well, this is a data set. And this, descriptor also points to different, further details. And what they're also doing in their search when you query this is they're using their knowledge graph. So they're, indexing all these different spreadsheets or publications or data information that's available for us to use, and do this. So having that in mind and moving into, well, what would a so-called smart data catalog be? What kind of parts would you possibly like to find? Well, obviously you would like to have an opportunity to, as I mentioned here with Google, to be able to ingest, harvest, and operate on the data that you're going to be using. Basically, pinpoint, as in FAIR, find the data, where it sits, and how you work with that. The second thing is called enrichment or refinement or analyze the data sets. And when you do this step, you will possibly use different vocabularies, terminologies, classification systems, or code systems, so that you're able to connect the data points from all of these different data sets and make them even better. So you get a richer metadata representation. And the final step will be to search and access the data. So this is lots of nice pictures, but I rather move into, well, how does it work in reality? So let's do that instead. So I will show you another thing here. So, well, here is a specific resource. Data World has provided us with a huge set of different resources, as you can see here, in terms of the coronavirus and COVID-19. Data World is relying on the open standard DCAP AP, which is the W3C ratified standard for a data catalog, which is also used for open data, which Matthias will speak a little bit about later. So what I did, just for fun of it, because I'm a data nerd, I put together my own little Nordic data program here. So here you can see my Nordic Health Data. And I would be happy to have different data that I would like to work with. So what I did, I connected a few things. So for instance, here we have the from our in Sweden Folkhälsomyndigheten, or the Health Authority of Sweden, to see, well, how is the recent updates on the data about the population and how many has been died of the coronavirus. And as you can see here now, I'm syncing to the updated version of their stuff. So I could either integrate and upload my own CSV files, or do connections to my internal databases, but I can also connect to different resources. Similar setting I did here, because since Lars is here and he's working for Västra Götalandsregionen, and I wanted to be positive in that sense, so I added the data set provided by Västra Götalandsregionen about where do they have different instances of health services provided by hospitals and so forth, with the address and so forth. What I can do now, if I going back again to the expressed terminology that I showed you in the tool for building ontologies and terminologies, is that I can run that and say, well, here's a few items here in the columns telling me something about, this is a street name, this is a postal number, and so forth, and this is a name, which is a person name. In this tooling, with this tool and this knowledge engineering tool, I'm then able to add this on top, so that I can actually say, well, this table column speaks specifically about person name, and person name is a concept that I hold in my specific ontology. And a little bit conscious of time, I will do a quick assessment just because I like to have fun things to show you. So I'll show you. This one I showed you quickly last time around, but I'm so happy with this one, so I'll show you it once again. So this is another tool, and well, obviously I need to start to log in here again. First and foremost, I'll just show you. So this is the 155 available data sources that this specific service, which is also leaning upon FAIR data principles and data catalog principles, that they have integrated with. So PubMed, everybody who's working within healthcare know what PubMed is, but there's a lot of other here. So the list goes on and on and on. And here you got Mesh, which means that in the behind the scenes, we have all the open vocabularies, exactly what we say in the interoperability, the I in the interoperability in the FAIR, they should be, be used. And then you have an ontology graph. Once again, showing you a graph, and hopefully it will load before my time is out. So here you see the graph rendered, so how these different data sets and things are connected with each other, and you can traverse walk through these different things. And as I showed you last time around, here you can search for instance, vaccine, and I would see, well, how many patents has been provided recently about vaccines. And as you can see here, all these things are related to the data vocabularies, the vocabularies that speaks about this, but I can also further see, well, how many publications about patents has been, made available by using this tool. It's not so much about the tooling, it's about the thinking about using open standards for provisioning of data. And there's my time over. So now I will be happy to shift over to my fellow friend Matthias, and fingers crossed that everything works so smoothly as it should. So Matthias, the scene should be yours in a second.
Hi, so this is Matthias Ekhem speaking. I bet you have the presentation, Fredrik, isn't that so? But the presentation from...
Yeah, but you can run the presentation yourself. So I'll put it together in one slide deck that we will share with everybody afterwards. So run your show.
So this is, so now you see the presentation, is that correct? I start with, my name is Matthias Ekhem, and I work as an information architect at the Agency for Digital Government. And I'm mainly going to speak about basic data and an assignment we have. We have an ongoing work with a framework for basic data, and I'm an assignment manager for this work. We also, just shortly, I can say before I start, as Fredrik mentioned, the DCAT AP. We recently have a new version of the DCAT AP SE, the Swedish translation of the latest version from EU DCAT AP. And since May, we have a new version of this specification, and it will be used on the data catalogs you can reach at the dataportal.se, so you can see them there. Some background from this work with the framework for basic data. We got an assignment in 2018 that was about secure and efficient access to basic data. And the assignment started in May 2018 and was given to the three authorities, the company's registration office, the tax agency, and the mapping, cadastral, and land registration agency. And in September, DIG started as a new agency and got the role to coordinate this assignment. And as we came up with this definition of what is basic data, and we say that it's information within public administration that several actors need and that is important in society. Much of it is not open data as such, but it's shared data, and we need to describe it in a similar way and how to access it, because mainly in the public administration use this data in their daily work. So we proposed in that report that we should establish a national framework for basic data, and start off with 3 basic data domains. The one person, mainly person registration that the tax agency is responsible of, in companies with the Swedish Companies Registration Office, and last domain that in fact is 2 domains, but they say it's 1 domain, the property information and geographical information for the mapping and cadastral and land registration authority that is responsible for that one. We got a new assignment this December last year, and it mainly said, do as you proposed in the last report. There is also the Swedish Civil Contingencies Agency is now a part of this work, and they are doing a lot of good work at the information security area about basic data. And now we have the work in progress, mainly legal things, that how do we secure that one agency can be responsible for the framework, and how do we secure that the different roles that we propose should have the authority we say they should. We are doing some, in this framework, we are doing modeling rules and principles and guidelines for how to describe the basic data and to reach it in similar ways. And we also make processes for how to decide when new basic data will be created, and how to be a domain for new basic data areas. For example, environmental data, or as this seminar about health data. There are many areas that could be basic data domains. This picture is about some kind of concept model of what we say standardized basic data. We call it standardized. When it's within the framework, the data have to follow some rules and standards. So we say that standardized basic data has a known quality. It has a primary source. Many of these standardized basic data nowadays you can reach person from many authorities, but we here say that person information, for example, it should be reached from the tax agency's registers. Standardized basic data is available and it's free of charge within public administration. Of course, in some time further, it should be free of charge, period. But nowadays, it's like this, that both the Mapping, Cadastral and Land Registration Authority and the Swedish Companies Registration Office they sell their data, and that is their business model. That is how they are financed. So a first step is to not let the public administration pay for it, like municipalities and other public authorities. And that is an important step to data, that the data should be free of charge. We also say that the standardized basic data has an identified protection value. It is usable and it supplies social benefit. It also has to follow established requirements regarding these things, quality and how to manage the data. We also say that it's used by several actors. It's not standardized basic data or not of interest if only one actor uses it. It has to be several actors that is interested or to use it to for the data to be within the framework. And standardized basic data is core objects in social processes. Like, for example, these three that we start with, person, companies, and so on. This was mainly what I was thinking of presenting to you now.
Thank you very much, Matthias. So we're timely, and now I will see if I can, my fellow friend Magnus, to be presenting. Hang on, let's see. Make Magnus to presenter. So Magnus.
Yep. Yeah.
Show us some fun stuff with metadata.
Yeah.
Us being metadata nerds, we like metadata, so it's a beautiful word.
Okay, so my name is Magnus Eriksson, and I work as a business architect and information architect at the Swedish Research Council. And today I'm going to say a few words about the metadata repository that we developed to support register-based research. So in 2013-14, something like that, the Swedish Research Council got a government commission to improve the conditions for register-based research. And the background was a government commission that concluded that we had a lot of high-quality registered data sources in Sweden, but that the utilization was too time-consuming. So it was the lead times from when the researcher formulated their research question to when they could get the data and utilize it, it was too long. So what we did was that we set together reference groups with register-based researchers from different domains and with different experience levels and backgrounds. And we started to put down the process that they used when they did their work. And then we looked at the bottlenecks in this process, and we figured that a lot of the bottlenecks was quite early in the process. So the researchers in the reference group, they lifted that one of the problems when they approached new data sources was that it was sometimes tricky to find data on a variable level, because the variable names was not really self-explanatory in many cases. So and they wanted to find a way to search from a more concept kind of view, to use business concepts and search and then find their variables that way. They also, when they found the variables, they needed to evaluate their meaning, and both separately, the variable, but also in relation to other data sources that they were using. So they needed to evaluate the interoperability of the data on a variable level, and actually also below the variable level. Another thing that they encountered was that they needed to put a lot of time into managing data and data transformations and laundry and such when they set up their studies. So they needed some way to not only interpret the meaning of the content, but also see what types of changes had occurred to the data over time, and how could they manage that. And that could be a quite time-consuming process when they worked with longitudinal studies. And the final block of things that they lifted was that they needed a way to see what had been done with the data on the way into the data source in order to establish trust for this data source. So they wanted to see who had done what to the data. And that this provenance part is actually one thing that we have not built yet in the tool, but it's something that we are looking to start building. And if you have been listening to the early presentations, you might recognize these criteria because a couple of years later, I think it was 2016 or something like that, a conference in Leiden within the life science community, they formulated the FAIR principles. And there were quite a good overlap or correlation between the requirements from our reference groups and the formulated FAIR principles later on. Okay, so that I think I will show you a little bit how we support these FAIR principles. If we start with findability, we work with sensitive data. So in order to support the researchers early in the process, we need to provide quite rich and deep metadata for them to be able to find the data. So we do that using GSIM, Generic Statistical Information Model. It's a metadata, standardized metadata framework that is governed by the UN. And we use that to provide the metadata for findability. And then we also make use of the semantic mapping that is providing search opportunities. So the semantic mapping that we work when we curate the data and the data sets, we reuse that during search. So we can find not only the exact thing that we are searching for, but also close relatives and so on. As I said, we work with sensitive data, so we needed to separate the data from the metadata. I'm not quite sure if this GoToMeeting console is in the way of when I'm showing the picture, but hopefully not. As you can see here, there's a process of ethical review and harms test, and also a disclosure process before the researcher can get access to the sensitive data. So in order for us to support them earlier in the process, we needed to separate the metadata and the semantics from the data part, so we can work with supporting them with things that are not sensitive. So we did that in this metadata repository. So we only hold metadata in the metadata repository. When it comes to the interoperability aspect, we have a quite large focus on semantic interoperability. Although I just wanted to point out that there are more aspects that need to be managed when it comes to interoperability. There's the legal interoperability aspect, the organizational one, and the technical interoperability part. But the main challenge we believe, and that we have been working most with, is the semantic interoperability part. So what is semantic interoperability? Well, if we have a couple of variables, these ones are actually from a bladder cancer register that we have been working with recently in cooperation with a project that Lars has been running. It's called the Sweeper project. And then if we have a couple of variables here, B, sit, N, inst, and C, blue, we don't really understand maybe what they mean, so we can't interpret them. So now we have mapped them to a term. These terms are in Swedish: cytostatika engångsinstallation and uppskattad perioperativ blödning. And for you that are not speaking Swedish or understanding Swedish, this might still be a bit tricky to understand. But if you are speaking Swedish, you can read the definition of the concept, and then you can get you can evaluate the meaning of the variables if you are a person. But if you want to do this on a more machine readable way, you can use the mappings to the machine readable terms that in this case we have mapped, or we got the mapping from the Sweeper project. So we map these variables to the SNOMED CT concepts, and then if you read this, if you're a program, you can read these codes and you can understand the semantics of these variables. What do they actually mean, regardless of the language, because the ontology will contain several terms that give descriptions in different languages, but it's still the same code. So if you read it, if you're an English-speaking person, you can use the English term for the same concept ID here. And this is, of course, also very interesting if you want to write software to evaluate the meaning in the registers, because it will be much quicker and more efficient than if you want to use several data sources than if you want to do this evaluation in person. So this is quite nice. In the register utilizer tool that we have developed, the metadata repository, we support the journey towards increased interoperability, because the starting point is not always that all the data sources have done their semantic mapping to machine readable ontologies and concepts within this. So we want to support them in the process, the journey towards increased interoperability, to start with good, clear definitions, textual definitions, if they want to do that. And then they can add links to machine readable definitions, so they can work progressively enhancing the semantic interoperability of the data source. And as you can see in the lower part of this picture, you can see that we also store other more structural metadata regarding the variables, such as when have they been collected, what are the versions of the representations used, and within which populations have these various variables been collected. So I thought I would just do a quick demo here of how you can use the SNOMED CT code. This is just a start search page for root. And then I just put in a SNOMED CT code here, so you can search, since we were talking about COVID in this case, we get a hit here on antiviral treatment. So then you can see that this is a concept, a register concept that is linked to a SNOMED CT concept here. I'm still not quite sure if you see now it disappears. That's good. Okay, so if you want to traverse this graph, you can go ahead and you can look at other types of antiviral treatment here. You can start, maybe you want to look at anti-COVID treatments. So then you can get the concepts here that defines different types of treatments that they are using in this registering data for in this register. So you can see you have a treatment with vitamin C against COVID, you have darunavir, you have steroids and such. So and then here, if you look at this concept, the term here is in Swedish, it's the register's term. But if you look at the semantic mapping, they have done that to a SNOMED CT code here, so you can read that regardless of language. But as I said earlier, it's a kind of a journey towards increased interoperability. So for certain variables, there are textual definitions, and for some have been progressing towards more machine readable ones. So you can say that you want to search here for, say, you search for activities of daily life. Maybe you want to see what happens after COVID-19 infection. So you can look at the post-intensive care data here from the intensive care register. And now I just search for a text instead of a SNOMED CT code. So you can see here that you get a mesh. You get a hit here on the mesh codes. In this case, they have a mapping towards to a mesh definition. here, and you can see what types of concept they are measuring here in the post-intensive care concept system. So say that you want to look at this variable, you can jump over to the more structural side here of the metadata. So you can see, okay, for this activities in the daily life, what type of data has been collected. So you can see that it has been collected from 2016 here. And you can see that it is using an interval scale in this case. So when you have gathered, we can look at maybe one more here. You can look, okay, in this case, I just wrote laboratory. So we can look at laboratory tests and find, for example, if you have different kinds of laboratory findings here. In this case, influenza A/B or corona and such. And then you can look at the code list and you can see, okay, how has this encoding been changed over time? So here you can see that they started to collect data with the code for coronavirus, the number 3 here, in March this year. So before that, you will not find the encoding for these lab findings. When you have found your variables, you can put them in your shopping basket here in order to put together your request for disclosure in relation towards the registers, the data owners. And as you see here, I just put together a list with variables from different registers: cause of death register, rheumatology, cancer register, and such things. So if you go to a more detailed view in the application, you can look at your variables and which registers they are registered in. You can add the definition if you want to see, okay, which one of these has machine readable encodings and what are they. You can see changes of representation. For example, if you want to look at what types of code lists have been used to represent this, and you can see how that has changed over time. Then you can use this in your request for disclosure of the data. Okay, so that was a really quick demo of the Register Utilizer tool. And what is the added value then with the Register Utilizer tool? Well, it's of course it's easier and more efficient to find, evaluate, and understand the register data. Much easier than to use the variable lists that are a bit trickier to get a good overview over and search in. It's also a good possibility, a good opportunity to reuse the semantic mappings made by my other projects to incorporate the curation activities that has been done by other projects and registers. So in this case, I had an example from the cancer register before I showed the COVID one, that we have reused the sweep projects mapping, and then we can reuse that to enhance machine readability. And of course, if we have machine readable semantics in the metadata repository, it will enable faster processing and faster processes. Okay, so that was what I thought I would talk about today.
Thank you very much. So I'm very pleased. So let's see if we can arrange so that we will set me as presenter again. Two links. And then I thought of seeing if we could have you all presenters, Matthias and Magnus, to answer some of the questions. I haven't seen any questions coming in, but you feel free to do so, to submit questions to Matthias and to Magnus. So let's see, Magnus, if you do you have your video on as well? Well, anyway, yeah, there you go. So from my hello everybody. So from my point, I have a few questions. First, well, it's nice to see how the FAIR data principles emerged in the Open Fact project run by Life Sciences and so forth. That has now been emerging as a kind of a commonsensical way to think about how you should address your data management problems. So one question you referred to, Matthias, that the basic information, the three main domains will be a person, organization, and geographical or spatial data as kind of the first instance. But you already see that there's an emerging need for expanding into other domains as in environmental data, as we already know that there is an ongoing project specifically for that across Europe and also in Sweden. So what's your thinking about the health data? As Magnus here presented, is that it has some ethical and some privacy disclaimers saying, well, it could not be open, obviously, but it is really highly valuable data that is needed to be researched, as the root tool shows. So what's your thinking?
I think there are many initiatives in this area, and for example, the e-health authority. I'm not sure that's the correct English of the e-hälsomyndigheten, but they are also participating in a way in this assignment, and they had data from their site would also be interesting. And there is definitely some data sets that are not sensitive. For those examples we have seen here for different symptoms, and so that could be definitely could be basic data. You don't have to connect the persons to it, but the data is very interesting and needed to be handled in the same way.
Yeah, and I think going back to the seminar that we had a month ago, one of the key things, well, in these stressful times in terms of COVID-19, is obviously to be able to find correct information from the different authorities in terms of crisis. So where's the location for your healthcare unit, and which different what means should you do to address testing and so forth. These are both spatial data. Obviously, it's the address to, well, this is where you have a doctor or a nurse that will attend this, and these are the described as healthcare services provided, and these things should, from my way of thinking, these should be, well, open data. And I as I just showed the data set that I just connected to from Västra Götalandsregionen, where they have published all the addresses to healthcare units in Västra Götalandsregionen, as just one example. But that data set doesn't have a rich descriptor on which services are provided, or so these kind of questions. So that's my thinking. So what's your thinking, Magnus, about well, as you mentioned here, I mean, we all know that 80% of the data analytics and data management domain is trying to, even in the first place, find data. So what's the evaluation now, since Root has been live for a couple of years now and still progressing? What's the expressed feeling from the researcher community?
Well, I think that one of the things that has been developing over the last years is the increased demand for interoperability, the interoperability aspect. It started out a lot on the findability side. It's still, of course, it's still a requirement, but I think the progress that has been going on in the entire community has been going on largely on the interoperability side the last years. So working with mappings to ontologies and terminologies and increasing the interoperability, and I think that's been the largest thing. And of course, there are a lot of similarities between the open data work and the ones that where we describe sensitive data with metadata and semantics. So it's a lot of similarities. Yeah.
Another thing that mind, well, us in are in FAIR, and one of them, and you referred to it in your presentation, Magnus, about the provenance, basically saying who is responsible for this data, how has it been captured or curated or developed, and what does it mean, which is the semantic interoperability. Are you looking into using, because there are obviously vocabularies, open vocabularies to address provenance. Are you thinking of using that open vocabulary in terms of your metadata registry?
Yeah, that's correct. Yeah, so we're looking at to use the W3C prov standard, so and the prov ontology to use that, and I think that is one of the standards that has been getting a larger and larger use within the community. Yeah. Are you using
Going
any?
Back to,
yeah.
Go ahead.
Maybe I should stick to answering questions, but I was just curious, Matthias, are you looking at some provenance trace standards when you work with the open data?
With open data,
Yeah.
I'm not familiar with it. I'm not sure. Sorry.
I think it is, if you look at, it's connected to the DCAP AP, so you are able to, when you, publish data sets according to DCAP AP, you're also able to address the prov vocabulary saying, well, this is the provenance of the data that we're publishing on your DCAP AP data portal.
Yes,
for my thinking.
There is some classes in DCAP AP that addresses provenance. Is it that you mean? Because within the specification, there is possibility to, yeah.
Yeah, I thought when you're working with different basic data or then let's say person, if you kind of attach a provenance part to that also, or?
Yes, within that scope, that all those we're making models of these basic data areas, and all those data sets that are modeled, we are also going to describe them with DCAP AP SE and make them available at the data portal SE, dataportal.se. So in some extent there will be a provenance from DCAP AP.
Good, and I think it also going back to the cross-referencing because register, as you said, I mean, not all data will be open. Some of it will. You have different ways of financing your data management, obviously from different agencies. So, but in that case, it's still the same, being that these basic areas that you work with, they should have a kind of a provenance, accountable. So we are accountable for this from the tax authority, that you as an individual, these are the the properties and these are the data that speaks about you, or the organization. With these are the facts of your organization, or these are the spatial data points that that the different authorities are responsible for. So I think in many of these cases, it goes back to, well, that they're working together. Did you have a question, Lars?
I was just thinking a little bit about the data, we call it, what did you say, Magnus? Sensitive data, yeah. Do we have a good definition of what we actually mean with sensitive data? So I think that is starting to be a problem when we are combining different data sources. That sometimes might not be sensitive from that perspective when we publish it, can be sensitive when we connect them together.
Yeah, that's a really good aspect to highlight. Yeah, because and that's why because we totally separate the metadata from the data, and of course, if you would get some summary statistics of the data, if you know what set of summary statistics you have, it could be non-sensitive, but if you would be able to add external data sets to this and link it to it, it could become sensitive, or it could become possible to re-identify more granular data. Yeah, so that's a good perspective that needs to be taken into account. Yeah.
Why I raised this question also was I was listening to the responsible manager for Twitter on the trust to the social society. And she said, we handle about 500 million tweets per day. And out of them, 180,000 might be not so good. And in that perspective, they are actually a problem for them. Because when we look at our data, it's so seldom that we have those outliers. So we don't think that they are dangerous. But I was just thinking so. So it might be that we will address those issues on privacy and those things further from, if it's an interest of it. Perfect, yeah. Thank you. I see the time is moving. Fredrik?
Yes.
It worked well when I was in the same room as him. So.
So everybody who has been attending this seminar, I'm very pleased that you stayed all through, because we were nerding into metadata domains and speaking about standards and stuff. I hope that was interesting enough. We will obviously hand out the presentations and also further links to more reading, and hopefully we'll be able to touch point on further webinar post the summer vacations. According to the authorities, now we are able to travel more than 2 hours by car, so that means that we are at least might be able to see each other, obviously with social distancing, continue with the social distancing. So with that said, I'm very glad to have Magnus and Matthias and Lars here on the call, and I wish you all a pleasant summer. And we actually do have quite a good summer weather here today in Sweden. So for all of you on the other side of the pond, I wish you a good day as well. So bye-bye, everybody. Thank you.
Bye-bye.
Bye.
Bye. Thanks.